Artificial urinary sphincter and the male sling for urinary incontinence, what you need to know to be prepared for major surgery. Let's talk about male urinary incontinence. You may be surprised to learn that urinary incontinence affects more than 52 million Americans and Europeans. At age 60 or older, approximately 5% of men are incontinent. For those older than 60, 15 to 30% of non-institutionalized people are incontinent, and fully half of people living in nursing homes have urinary incontinence. This means that 800,000 men have some problem controlling the flow of their urine, and up to 50% of men will have some degree of incontinence following a radical prostatectomy. Let's talk about the different types of incontinence. There are three: overflow, stress, and urge. Overflow incontinence is usually caused by a blockage in the urinary channel, and this causes the bladder not to empty properly. Stress incontinence is when there's a relaxed pelvic floor or a sphincter problem. And urge incontinence is from overactive bladder, different neurological disorders, and can cause the bladder to squeeze inappropriately. There are a variety of options available for male urinary incontinence: urethral bulking agents, condom catheters, diapers and pads, a Foley catheter, a male sling, and an artificial urinary sphincter. Let's talk a little bit about the male sling. A small sling that's made out of synthetic mesh is surgically placed inside of the body during a procedure. This sling will support the urethra, and remember, the urethra is the tube that transports urine from the bladder through the penis and out of the body. When the sling is placed, it will work independently, without manipulation, by repositioning the urethra back into its normal position. This procedure can eliminate and reduce the possibility of leaking, especially during strenuous activities like exercise, lifting, sneezing, and coughing. How does it work? So by repositioning the sphincter back inside the pelvis, the patient's membranous urethra will get longer, and that will help and restore continence. Most patients are continent immediately after the procedure and can quickly resume normal, non-strenuous activities within a few days. The procedure is outpatient and can be performed under spinal or general anesthesia. Only 3 small incisions are needed, and the recovery is very quick. There's no device activation that's needed, and often no catheter is necessary upon discharge. Patients report immediate improvement in their leakage and a restored dignity and quality of life. So the placement of the male sling can be completed approximately within an hour as an outpatient surgery. Before the surgery, your doctor will go through exactly what will happen during the procedure and how you should prepare for it. The doctor will explain the procedure in great detail and describe the associated risks. Be sure to discuss any concern you have with your physician right away. The small sling is made out of synthetic mesh and is implanted into the body through 3 very small incisions. It's placed under the urethra to optimize the sphincter's function, and then the incisions are closed surgically. There are some risks with the sling, including infection, bleeding, persistent incontinence, potential injury to the urethra, erosion of the mesh, urinary retention, or the need for another intervention. What can you expect after the procedure? Your surgeon may insert a catheter through your urethra to drain the bladder after the surgery, but fortunately this is usually removed that same day or shortly thereafter. Most patients are continent immediately following the procedure and can quickly resume normal non-strenuous activities. Your doctor may prescribe antibiotics for a few days after the procedure. And most doctors recommend that normal activities can be resumed only after a few days, although patients should avoid strenuous exercise like heavy lifting and straddle exercise like biking and cycling. Intercourse can be resumed after 6 weeks, but ask your doctor for their personal instructions. Who is a good candidate and who is not a good candidate? So patients that have urinary tract infections, bleeding disorders, a compromised immune system or a problem with healing, or a severe obstruction of the urinary tract may not be good candidates for this procedure. So how does the artificial urinary sphincter work? The device mimics a healthy sphincter in that it keeps the urethra closed until you want to urinate. It does this by automatically moving fluid, such as saline, through three main components: the cuff, a pump, and the balloon. These components are then connected by a flexible, kink-resistant tubing. When you need to urinate, you release the pressure on the urethra so the urine can flow. You do this simply by squeezing and releasing the pump of the device. This action pulls the fluid out of the cuff and sends it to the balloon. Because the empty cuff is no longer pressing against the urethra, the urine can flow out of the bladder. Minutes after the bladder is empty, the fluid then automatically returns from the balloon to the cuff. And once the cuff is refilled, the urethra is able to be squeezed closed again. What are the risks of the procedure? They include infection, bleeding, persistent incontinence, potential injury to the urethra, erosion of the device, urinary retention, injury to intra-abdominal structures like bowel, blood vessels, and bladder, or the need for additional medical or surgical management. So let's talk about the procedure. In general, the placement of the device involves the following steps. The surgeon will make an incision near the scrotum to expose the urethra, then measure the urethra to determine the right size of the cuff, and then positions the cuff around the urethra. Through a separate incision in the lower abdomen, the balloon is then positioned in the abdomen, and the pump is placed inside the scrotum. The tubing is connected between the components, and it's filled with a sterile fluid. Depending on your level of incontinence, your doctor may decide to use two cuffs to achieve better success. A second cuff has proven to be successful in providing more control for men with persistent, severe incontinence. You wouldn't notice any difference in device operation if you have two cuffs. And then the surgeon closes the incision. Who is not a good candidate for artificial urinary sphincter? Patients whom the physician determines to be poor candidates due to anesthesia because of physical or mental conditions. Patients who have irresolvable detrusor hyperreflexia or bladder instability may not be good candidates. Patients with a known allergy or sensitivity to rifampin or tetracyclines may not be good candidates. Patients with systemic lupus, because minocycline has been reported to aggravate this condition, may not be good candidates. So is artificial urinary sphincter or the male sling covered by insurance or Medicare? And most times they are. We need to actually schedule the surgery, and then we will submit for pre-authorization. Our staff will notify you of any monetary obligation that you would have in regard to the surgery. There may be other expenses, including anesthesia and hospital bills if the procedure is performed in a hospital. You should consider the risks and potential benefits in your decision to proceed with surgery. It's ideal for men who are tired of urinary incontinence and have failed conservative management and do not want to be wet. Once you make your decision, we will assist in coordinating and scheduling. We will perform pre-authorization with your insurance and provide you with an estimate of any expected uncovered costs. Many of these procedures will be done in an ambulatory surgery center in your area. Some patients may need to be done in the hospital for medical reasons, and someone will need to accompany you and stay for the procedure and recovery. So what do you need to do prior to the procedure? You will need to obtain a history and physical, as well as blood work, by your primary care provider. Most patients will need to stop aspirin and blood thinners roughly 1 week prior to the procedure, and you'll get a list of these medicines. But never stop these medicines without first discussing this with your primary care physician. You will not be able to eat or drink anything after midnight the night before your surgery. In terms of special preparation, your physician will help you decide which of these procedures is best for you. You will need to shower with chlorhexidine solution to clean the skin the night before surgery as well as the morning of surgery, and you'll be provided with this cleanser. It's important to arrive 1 hour before the procedure. On the day of surgery, you'll need to arrive at the designated time to the surgical suite, again, roughly 1 hour prior. The nursing staff will say hello, prepare you, and place an IV and start your antibiotics. You will then meet your anesthesiologist who will discuss the type of anesthesia to be used during the procedure and potential side effects. You'll sign a consent for anesthesia. You will then meet with your surgeon who will also obtain a surgical consent. You should urinate just prior to going into the operating room, and the procedure will take about 45 to 90 minutes. You should expect to be in the recovery room for 1 to 2 hours following. Some doctors will leave a catheter in overnight to drain the bladder. There's nothing fun about the catheter. It can be uncomfortable, and it will make you feel like you have to constantly urinate. But usually the catheter is removed the day after the procedure. In the recovery room, the nurses will help wake you up from surgery. Afterwards, they'll give you something to eat and drink, and they'll make sure your pain is under good control. They'll review with you how to take care of the Foley catheter and go over all the medicines at discharge. They'll also review your surgeon's discharge instructions before you leave. Post-operatively, you'll probably receive antibiotics for a couple of days, a prescription for pain medication, and it's important to start stool softeners as the pain medication can make you constipated. At home, you can eat and drink normally, and you can shower post-operative day number 2 or 3. You'll need to make an appointment to see your surgeon back in 1 to 2 weeks. Another appointment will be scheduled roughly 4 weeks after the procedure on how to use the artificial urinary sphincter, and your doctor will tell you when it's safe to start using the device. Most patients will return to work 1 to 3 weeks after surgery. When do you call your doctor? So if you have a fever postoperatively greater than 101.5, if you're experiencing chills or drainage from the wound, if you notice any redness of the wound, it's important to call. If your pain is not adequately controlled, if you're unable to urinate or your catheter is not draining, or if you're having constipation despite using stool softeners. If you decide to undergo placement of a male sling or artificial urinary sphincter, we do hope that your procedure goes well. We greatly appreciate your feedback as we're always trying to improve the care that we provide our patients. If you have any questions regarding your procedure, please contact your urologist. Thank you.